Hi guys, my name's Frances and I'm bringing you today's Pilates ITC teaching tip, and we've got Suze here being our body. And what we're going to go through is something really foundational in the Pilates work, and that is the neutral pelvis positioning and into an imprinted position. And it's so crucial to get that element correct, because it does formulate the start of many of the Pilates exercises and shapes, so can be also really difficult for clients to master as well. Neutral pelvis, starting with that, we want our two ASIS level with our pubic symphysis, and in this positional body lying shape we want it level with the floor. So Susie's in a beautiful spot there, and we want to be able to think of having almost a flat plate that we could rest our cup of tea on her pelvic triangle. And then we also do want these ASIS to be level on this transverse plane as well, so we wouldn't want to have one hip sitting higher than the other, and that's quite easy to feel on the mat because of the feedback of the mat, but much harder if she was to be standing or doing something where she didn't have quite as much feedback underneath her. So in this neutral positioning, you'll see that the legs are getting a beautiful downhill slope right into the hip joint where the greater trochanter is, and her lower back has her natural curve of her spine, so she's certainly not pressing any segmental portion of her back into the mat. And the rest of her curves are able to sit there freely. So if we were going to change this position into an imprinted position, what we would want to think about is having our legs be the stable aspect of what we're doing, and the pelvis and spine then rotating around the hip joint itself. So if Susie started to imprint already, come back to neutral there, Suze. Let's take an inhale. And then on the exhale, think about pivoting around that hip joint, feeling the sitting bones sort of coming up into the front of the legs and letting the low back draw toward the mat. And then you're going to inhale to take yourself back to neutral, feeling the spine lengthening out. You can go even that little bit further there, Suze. So this time pivoting that way. And then on the exhale, she's going to go into her imprint again. And really making it a pelvic-driven movement, and then the spine will follow through as well, of course, into the movement, but not just sinking the back into the mat. You want to really feel the rotation of the pelvis around the leg bones. So I think that can be one aspect that clients can find difficult to understand and to feel. So often this joint can get stiff over time and there's less movement there. So if you almost consider that the hip joint be the last spinal joint, even though that's not the case, but it's a nice imagery to help clients really understand that movement. How does that feel?
Great.
Really good. Thanks guys.